Hi, my name's Darryl Reed. I work for Tissue Repair and I'd like to introduce a new product, TR Pro Plus, which is a hydrogel formulated for the aftercare of aesthetic and medical procedures. TR Pro Plus represents a new standard in aftercare treatment, one which is firmly underpinned by science. Beta-glucans are polysaccharides that are composed of individual sugar subunits that are linked together in a specific way. While beta-glucans are naturally found in the cell walls of bacteria, fungi, algae, and cereals such as oat and barley, the linkage of those sugar subunits is different in each of these. The active ingredient in TR Pro Plus is a beta-glucan that comes from baker's yeast, and shortly I'll tell you why it's different to other types of beta-glucans. It's been known for many years that beta-glucan from yeast can modulate immune activity, and the differences in the shape, structure, and molecular weight determine the level of that activity. The challenge has been in purifying the beta-glucan in a way that doesn't cause it to break down in size. And over the past decade, Tissue Repair has developed the technology to purify a large insoluble beta-glucan, which we refer to as our patented active ingredient, glucoprime. When TR Pro Plus is applied to the skin, it penetrates the outermost layers and moves to the dermis, where it encounters macrophages, which are considered to be the guard cells, continually on the lookout for foreign objects like bacteria and fungi. The macrophages recognise the beta-glucan as being foreign, and this recognition kicks off a process of macrophage activation, which involves the production of growth factors and cytokines that attract more cells to the area. Together, these cells produce factors that play a key role in skin repair, including the production of collagen. As I said, the beta-glucan in TR Pro Plus, glucoprime, is a large insoluble glucan, and this large size is necessary for the macrophages to become activated. Small beta-glucan molecules cannot activate the macrophages in the same way, and that's why it's important to remember that when you come across a product that contains beta-glucan, you should question whether there is scientific evidence to support the skin healing effects for that particular glucan. For skin to heal, it first needs to create an inflammatory environment. During the inflammation period, any foreign bacteria and damaged skin cells are removed, which is necessary before new tissue can be laid down. Inflammation is controlled by macrophages, which regulate a wide range of processes. They ensure that the different healing components are switched on at the right time and in the correct amounts. Macrophages can be classified as either a pro-inflammatory or M1 type macrophage or anti-inflammatory M2 type. So imagine you accidentally cut your finger. Shortly after, the area becomes red, swollen, and slightly warm. This is inflammation, which helps to prevent infection and starts the healing process. The wound might ooze a bit and form a clot. M1 type macrophages are active during this time, helping to kick off the healing and clear any potential threats like bacteria. A couple of days later, you might notice the cut on your finger has started to close and there's new skin forming. It's less swollen and red now, but might have a pink, fresh scar. And during this phase, it's the M2 type macrophages that are active, aiding in tissue repair and regeneration, smoothing out the wound, and eventually restoring the skin almost to its original state. The inflammation produced following an aesthetic or medical procedure or a skin wound is reinforced by the activity of TR Pro Plus. While inflammation is necessary, it tends to be tightly controlled because extended inflammation can diminish the quality of new skin. After about 72 hours, the inflammation subsides so that the skin can commence healing, and this process may last for 3 to 6 weeks. This coincides with the macrophages switching from the M1 type to the regenerative M2 type, and TR Pro Plus can facilitate this macrophage transition by producing the cytokine interleukin 10 at the appropriate time to ensure that healing can proceed optimally. Tissue Repair is a biopharmaceutical company, and TR Pro Plus has been used in a phase 2 study that was registered with the FDA and was published in 2022 in the peer-reviewed journal Dermatologic Surgery. The study was randomised and double-blinded, which is the highest quality trial design. 40 patients were enrolled in the study who had undergone CO2 laser skin resurfacing and who applied either TR Pro Plus or a placebo gel daily for 5 days. At day 28, an assessment was made on the skin quality using validated scales for wrinkling and elastosis. Compared to the placebo group, those patients on TR Pro Plus showed a 35% improvement in wrinkling and a 40% improvement in elastosis. These results confirm that TR Pro Plus accelerates healing and improves skin texture and quality. In 2022, a real-world evidence study was set up to capture direct feedback from patients who had used TR Pro Plus. The program involved 12 dermatology clinics across Australia and included 48 patients who provided anonymous feedback at days 6 and day 28 on a range of procedures. The procedures included a mix of aesthetic procedures such as laser, needling and light therapy, as well as medical procedures like biopsy, skin cancer removal and dermatitis. This study confirmed that TR Pro Plus was able to improve the patient experience by reducing dryness, itchiness and tingling. The soothing and calming properties of the hydrogel were able to control any pain, and the skin was kept hydrated by the biofilm layer. 85% of patients perceived their skin to be healing well, and of those who had previously had a procedure, 100% said that TR Pro Plus was as good as or better than their other aftercare treatment. Since TR Pro Plus was launched in June, we've had many examples showing the remarkable effects of the aftercare gel, and our customers range from plastic surgeons who are using it on sutures to dermatologists who are using it post skin cancer removal and cosmetic therapists who might be using it following laser and aesthetic treatments. I'd like to share a few of the case studies where TR Pro Plus has been used following medical procedures. In this case here, an elderly man had a BCC removed from his lower leg, which subsequently became infected. This area of the leg is notoriously difficult to heal in older patients, but after as little as 5 days, the wound looks remarkably healthy compared to the inflamed, angry wound at day 1. In this case, it was a lady who had received a head wound and who had applied TR Pro Plus daily. By 7 days, you can see that there is barely any evidence of the damaged skin. This is a case of a superficial burn where a barista approached our stand at a conference and they were kind enough to take some photos. The baseline photo shows the burn at 5 days and the skin is still red and inflamed. But after 3 days use of TR Pro Plus, the skin has almost healed completely. This final case shows the application of TR Pro Plus to skin following an excised skin cancer, indicating the gel can be applied to the skin immediately after the sutures have been done.
As a cosmetic nurse, I've worked with a wide range of modalities that require post-care product to be applied immediately on treated skin, in clinic and at home for the days that follow after treatment. However, finding a product suitable for all skin types that was pH balanced, breathable and anti-irritating was difficult. TR Pro Plus offers a science-backed formulation that can be used post a variety of cosmetic and medical procedures, skin conditions, and is unlike anything on the market. The benefits of TR Pro Plus include protection from external factors like bacteria, management of inflammation and redness, reduced itching and tingling due to its cooling and soothing effect, improved hydration, and an improvement in elastosis and wrinkling by up to 40%. For skin treatments that create a micro wound in the skin, such as needling or ablative lasers, TR Pro Plus accelerates healing, increases clients' comfort during the healing stage, and delivers better outcomes due to its ability to increase collagen. As a nurse, I can also be rest assured that my client's skin is protected after injectables due to the semi-permeable layer that stays on the skin until it is washed off, thus reducing my patient's risk of infection, downtime, and hand holding. We recommend you apply TR Pro Plus 1 to 2 millimeters thick immediately post-procedure and for a minimum of 5 days or until the wound has healed. A longer treatment will give a better result. Popular treatments where TR Pro Plus is being applied post-procedure include BBL, RF needling, CO2 laser, PDO threads, injectables, and Tixel. When applying TR Pro Plus, it's important to apply enough in the initial application so you don't have to reapply more once the semi-permeable barrier has already started to dry. We also advise you wait 5 minutes for TR Pro Plus to completely absorb into the skin before patting on moisturiser and sunscreen over the top. The following are examples of accelerated healing post-skin treatments using TR Pro Plus. This is a split face example post-fractionated laser resurfacing. As you can see, the side of the face that had TR Pro Plus applied has less redness and less laser grid in comparison to the side of the face that had other aftercare applied at 18 hours post-treatment. In this photo, TR Pro Plus was applied immediately post-skin needling and the acceleration of healing is evident. The client also felt the cooling and soothing properties enhanced their experience overall. When looking at this photo post-RF needling, pay close attention to the two middle photos as they show a dramatic reduction in inflammation within 1 hour of TR Pro Plus application. This client had irritated flaky skin post a chemical peel. 18 hours after applying TR Pro Plus, this client's skin was noticeably less flaky and felt soothed without compromising the benefits of the peel.
How to repair skin barrier, any product treatment recommendations, please? Okay, I'm not sure if you remember, but when I went to aesthetics, I spoke to you guys about a product that I walked past the stand and I was like, oh my God, what is this? It was the TR Pro. Now, beta-glucan, as you know, is one of my favorite ingredients in terms of feeding the immune system of the skin and enabling your skin to respond better to trauma in whichever way, shape or form. Beta gel, I've spoken to you about from DMK, as well as MediSoothe from O Cosmetics. This is beta-glucan in its original form and basically on steroids. We are using this post-treatment in clinic at the moment, and it honestly is fantastic. And I do recommend it to you guys to heal a skin barrier. Also, I have been using it a couple of times a week as like a face mask. So putting on a thick layer and then just allowing it to seep into the skin and going to bed with it on. Because you can never have too much anti-inflammatory on the skin. And also, as you guys know, my skin had a little episode the other week where it was flushing quite red. Even my alpha-red, which I usually tolerate really easily, was irritating me in terms of making me tingle quite a lot, which is so unusual. So the only fault that I give it is the size of the tube, because I honestly need 5 times this size in the clinic and from home. But it's beta-glucan. The patented ingredient in there is called glucoprime, and it's a very large molecule, and they've left it in its raw state. And in terms of wound healing, skin barrier protection, anti-inflammatory, honestly, it's brilliant. Burn has been using it as well, post a lot of CO2s, and Dana, Stephen, everyone.
In summary, glucoprime, the active ingredient in TR Pro Plus, works to modulate the immune system, which accelerates wound healing and improves elastosis while reducing the appearance of wrinkles. The benefits that are provided by TR Pro Plus are broader than for any other aftercare product currently available. TR Pro Plus can keep the skin moist through reduced water evaporation due to the biofilm, together with deep tissue hydration. Being semi-occlusive, the barrier still allows heat to dissipate and oxygen to transfer across the skin. And the hemostatic property of the hydrogel can also help in managing bleeding. Thanks for listening today.